Good evening, everyone. I'm Carl Ross, Director of Marketing at Biolase Technology, and it's my pleasure to welcome you to the online seminar, Waterlase MD Turbo. Smile, you're on candid camera, introducing the Ezlase 940 for better oral health with Dr. Christopher J. Walensky. Dr. Walensky will present for about 30 minutes and has generously agreed to answer questions on the topic following his presentation. Because we have quite a few attendees this evening, we will ask you to submit your questions using the Q&A capabilities of the webinar system anytime during the presentation. Simply place your computer cursor in the box below the Q&A window and type in your question. Dr. Walensky will review these questions and provide answers at the conclusion of his presentation. In case we run out of time, we will arrange for Dr. Walensky to answer your questions sometime after this event. His email address will be shown at the conclusion of the presentation in case you would like to contact Dr. Walensky directly. We are also joined this evening by Dr. Wayne Harrison, Regional Sales Director for Biolase in the United States, who will assist Dr. Walensky in reviewing your questions submitted, and he'll help with any technical or product-related questions as well. This webinar is being recorded and will be available for viewing in a few days. A link to this recording will be on the Biolase homepage at biolase.com. And with that, on behalf of Biolase Technology and Henry Schein Dental, I want to thank you for attending and introduce Dr. Chris Walensky. Christopher J. Walensky, DDS, is an author, instructor, and innovator in laser dentistry. His text on laser dentistry has been published in 10 languages. In addition, Dr. Walensky has published numerous peer-reviewed laser and oral systemic total patient health articles in journals throughout North America, Australia, Europe, and Asia. He is a diplomat and immediate past president of the World Congress of Minimally Invasive Dentistry and is the only American representative on the editorial board for the International Society for Oral Laser Applications based in Vienna, Austria. He was a founder and has achieved mastership status from the World Clinical Laser Institute and laser certifications through the Academy of Laser Dentistry. Dr. Walensky maintains a private practice in San Diego and is an adjunct professor at the Ohio State University College of Dentistry in the Department of Primary Care. And now, without further ado, here is Dr. Walensky.
Thanks so much, Carl. And I welcome all of you to this webinar to air my nervousness or dirty laundry. This is my first webinar. I recognize quite a few of the names of the attendees on this, including people from down under, believe it or not. Anyway, I've sat on my share of webinars, and the worst thing that I could do is waste your time. I appreciate you spending time with me and away from your families, because this is family time for all of us. I'm going to spend probably about 30 or 40 minutes discussing the key points of this particular diode laser versus some of the other diode lasers that may be on the market. And this program will be structured around probably those who have less diode laser knowledge than those who are more experienced, just to give you kind of a background on what we're doing here. So, when we talk about diode lasers, I really, a lot of the more experienced diode laser practitioners kind of shy away from, the basics. This is an entry-level laser, and it's boring, and it doesn't do as much as the $60,000 and $80,000 lasers. But I'll tell you what, as far as versatility, when we talk about different things that are in your practice, different equipment that's in your practice, I would defy you to find another piece of equipment in your practice that would have the broad-reaching implications of the Ezlase. For example, you're going to be able to use this laser in your periodontal cases. It's not just surgical. Typically, when we discuss lasers with non-users, the only things that they're probably familiar with are the surgical applications, such as doing a frenectomy or maybe reducing a gummy smile. But when we talk about using an Ezlase, not only are we talking about surgical procedures like operculectomies and gummy smiles, but we're also talking about being able to whiten teeth We're able to do techniques in decontamination in endodontics. We're able to bacterially decontaminate periodontal pockets. We're able to use this laser to do things called low-level laser therapy, which is actually something in the realm of pain therapy. This laser is the only diode laser on the market that's FDA approved for pain therapy. And while we don't have enough time to really go into the pain therapy applications in this evening's call, I will touch upon that. Whenever we talk about any kind of technology, we have to make sure that it's affordable. Can we justify the cost of adding this technology to our practice in a reasonable way? And the answer is absolutely yes. We're able to use special handpieces in order to whiten your teeth. As a part of your purchase, you end up getting not only a laser specialist to spend time in your clinic or in your dental practice, but you also get a full day of hands-on training with a certified trainer through Biolase. And then as far as portability and power, why that's important is that, yes, there are other portable diode lasers on the market, but the Ezlase has the highest power, offers the highest power of any portable laser on the market. So a couple of questions. Number one is, why even buy or consider buying a soft tissue laser? Number one is obviously a happy patient base. And why do we talk about happy patient bases? Well, patients are aware of lasers. I'm sure if you're on this call, you've probably, or your staff has probably received phone calls asking whether the doctor uses a laser in practice. It's real nice to be able to say, yes, come on in. We talk about minimally invasive dentistry, and minimally invasive dentistry is a huge realm that, again, we don't have a lot of time to talk about, but it's more than just cutting smaller cavity preparations. It's, in fact, dealing with patients in a medical versus a surgical mindset. Rather than just cutting holes in teeth to reduce the symptoms, we're actually treating patients from a medical standpoint and dealing with the bacteria using a diode laser, which is specifically designed to eliminate bacteria. We're able to have happier and healthier patients. The science shows us that there's less bleeding, there's faster healing. There's faster healing for a number of reasons, but some of it is because of the minimally invasive nature of the procedures that you're going to perform, and others is coming back to the low-level laser therapy, the pain-reducing mechanism of using a diode laser. And actually, there's not really a section on pain management, so let me go and address that at this point because I think it's pretty important. There's a phenomenon called low-level laser therapy wherein it developed in the field of veterinary medicine. And the veterinarians figured out that by using lasers at very low levels, so as not to cut tissue, but to have the laser energy perfuse through the tissue, there's actually effects all the way down to the cellular level. The horses were able to run without limping. The dogs were able to stand up again. So we know that there's not a placebo effect when we talk about low-level laser therapy. But in fact, lasers at very low power levels have an effect all the way down to the cellular level. There's a whole cascade of events. There's an increase in vascularity. The increase in vascularity helps to bring more oxygen to the area, and it also helps to eliminate the pain-producing chemicals that are in the area. It will increase the lymphatic drainage, so you end up decreasing the swelling. And as we know, so often post-operatively, swelling is the reason for a lot of the patient's discomfort. It will increase the release of endorphins. There is just a whole cascade of events. Again, I believe that Biolase is going to have an entire webinar devoted to low-level laser therapy and wound healing. But, I mean, even for periodontal surgery, it's been shown that there's an increase in fibroblastic and osteoblastic activity just by the fact that you're using a laser. And so all of these things are going to help us decrease the pain post-operatively. Those of us doing crown preps and veneer preps, you know that it's a big question mark as to what's going to happen after the cord is removed, and so we can eliminate packing cord, and I'll go into this in more detail in a moment. We're not going to destroy healthy tissue. Again, we get back to minimally invasive dentistry. Electrosurge, when we talk about the thermal damage caused by electrosurgical units and radiosurgical units, we talk about millimeters. When we're talking about lasers, we're talking about microns and individual cell layers when we're talking about damage that's caused by this particular technology. And because we're going to be able to open up our realm of possibility of different procedures that we may not do currently, we're going to provide our practice with an extra or additional sources of revenue. In these economic times, we are looking for things, some marketing, some not, but a laser will differentiate your practice from others in the community who are not laser savvy. It's been my experience, even in my own practice, that having a laser, I'm a general dentist, we didn't discuss that, but I'm a general dentist, but I did as much periodontal surgery and periodontal treatments as, maybe not as much as the periodontist, but I did quite a bit to the point where I became a referral source. There were general dentists who referred to me frenectomies and orthodontists who referred to me their children who were the patients who had hyperemic tissue and just poor oral hygiene, and it just goes on and on and on, the amount of patients that will end up coming to you. It seems kind of ridiculous sounding, but when you realize at the end of this 40 minutes, the possibilities of what you can do with a laser, it really will differentiate your practice. And as I say, the surveys do show that patients do expect you to have a laser. So we talked about why maybe to purchase a laser. Well, why purchase an Ezlase? Again, power and portability. There are other portable lasers, but we're talking about a laser that has 7 watts of power. If you're not familiar with lasers, then this is just a number. But as example, there are other portable lasers where the peak power is 3 watts or 2 watts. It's got a battery pack, which means that you can transport this laser from operatory to operatory very easily without having to unplug and plug in. We already have enough foot pedals and cords and all sorts of hoses coming out of our treatment areas. This is not going to add to that. And as far as tips and sizes, there's different sizes, lengths, and diameters. That's going to become helpful as you become more aware of the different types of procedures that we can do. Again, not only periodontal, not only surgical, but we can get into endodontic decontamination, and then there's a special handpiece for whitening and pain therapy, all in one versatile unit. So again, Ezlase versus other lasers. The Ezlase is the only dental laser that has FDA clearance for pain relief and pain therapy. It's an excellent whitening solution. If you're not currently using a whitening system, this is you would have the laser to do your surgical and endo and perio, and then now, in addition, you can also do whitening. 20 minutes of treatment time is not a misprint. We normally schedule our patients for about a 40-minute appointment, 45-minute appointment. The extra time typically goes to pumiceing, lip retraction, and gingival rubber dam, the liquid dam that we place on, and then fluoride afterwards. But the actual laser time is only 20 minutes. As far as comfort pulse, the Ezlase is the only laser that offers a comfort pulse feature. And this is not just some fancy marketing word. What this allows us to do is use this laser with such a short pulse that the body can't even feel it. And that sounds like some voodoo, but I'll get into that more specifically so that I can document what I'm saying here. Obviously, when you're using a laser, you get very minimal bleeding. Again, we talked about the opening of the lymphatics for decreasing of swelling and decrease of post-op pain. Because we're doing such minimally invasive procedures, oftentimes we don't need injections or we need less anesthetic. We often don't need sutures, hemostatic agents, or astringents when we're working. As far as the added revenue that comes out of increased patient base, saving time as in packing cord, and then more importantly, adding new procedures to your practice that you're not currently doing. This is the only real laser sort of physics that we're going to get into, but I think it's important to differentiate the Ezlase 940 versus some of the other lasers that are currently on the market. What we see here on the left-hand column is the absorption, meaning the higher it is on this peak, the more well absorbed it is. and then the wavelength across the bottom. This is based upon the electromagnetic spectrum and various laser wavelengths. Here we highlight three wavelengths, the 810, the 940, and the 980. The reason we have 810 is that that's the benchmark of diode lasers in dentistry. Pretty much everyone who has ever created a laser in dentistry, a diode, has had an 810. Ezlase, or Biolase, is the first and only to create a 940. This wavelength was developed for dentistry, and let's see why. Here we have some absorption curves, or absorption peaks, as we call them. So the higher up on this, again, higher up on this axis, the better the absorption. So ultimately, we would love to have all of these absorption peaks be way up here, but in reality, what we have is hemoglobin, whether it's oxygenated or not. And as we compare 810, which is the traditional diode, to the 940, we see in both cases that we get better absorption with the 940 than we do with the 810. What does that mean? It means that when you're using an 810 diode, you need more pigment in order for the laser to cut. Well, what happens if you don't have more pigment? Then you end up getting more thermal damage to the tissue. And here we look again where the line for the absorption of water crosses 810 versus where it crosses the 940. And we see in reality it's an actual 400%, so 4 times better absorption in water. What does that mean for us clinically? It means that the Ezlase, again, is able to cut tissue with less color in it. Why is that important? Well, not all the tissue that you're going to remove is going to be real erythematous, red, swollen, bleeding. What happens if you want to do an operculectomy on the distal of 17 or 18? Typically, that tissue is very fibrous. It's not red at all. If you try to cut it with an 810, you might as well use an electrosurge or a scalpel, because not only will it take you a long time, but you're going to burn that tissue. Because we have higher absorption in water and better absorption in pigment, you're going to be able to cut that tissue quickly and a lot less traumatically with the 940. A couple more things about lasers in general. All diode lasers are able to cut in what's called continuous wave mode, CW mode. Why don't we use this all the time? It cuts very efficiently because basically the laser is off, you step on the pedal and it's on. And the laser will stay on until you take your foot off the pedal and it'll turn off. Obviously the cutting efficiency is tremendous. However, as you can imagine, the tissue temperature just rises and rises and rises as the longer you are operating. You end up getting a lot more lateral thermal damage, a lot more inadvertent thermal damage, which is why most of the time when we're doing surgical treatment with the diode laser, we won't use continuous wave mode. Instead, we'll use a pulsed mode. And here, what happens is you step on the pedal and the laser's on, and then it turns off, and it turns on and it turns off. And these are very short time spans that this turns on and turns off. And as we can see, if we now compare the tissue temperature, when the laser is on, the tissue temperature will increase. When the laser turns off, it will decrease and increase and decrease. So we do get a relative increase in thermal temperature again, in thermal activities. However, it's a lot slower acting than if you had it in continuous wave mode. Now, this is how most diode lasers work. Don't get excited, but I'm going to skip here to this slide. Comfort pulse. This is what I mentioned before. That wasn't just a marketing term. Comfort pulse allows us to have the shortest pulse that's available in diode lasers at this point, which in this case is 5/100th milliseconds. If we move the decimal point to the right 3 times, that equals 50 microseconds. Just don't get too caught up in the numbers right now, but 50 microsecond pulse. It's such a short pulse that it only needs a short amount of time in order to cool back to baseline, and in this way we're able to use comfort pulse without increasing the heat of the tissue. Now let's go back one slide here, and let me explain why 50 microseconds is so important. Most lasers are going to pulse in milliseconds, which is 1,000th of a second. If you look back even 2 or 3 years ago, before the Ezlase was developed, every protocol was 20 milliseconds off and 20 milliseconds on, or 40 milliseconds on and 40 milliseconds off. That's 1,000th of a second, which seems like, boy, that's a really short time. A microsecond, which is this right here, is 1,000,000th of a second. Now, if we consider how short that is, the human body takes 150 microseconds before it can even discern a stimulus. In other words, if you can have a pulse that's shorter than 150 microseconds, the body won't even feel that stimulus. It won't even be able to react to it. So if we're operating in milliseconds, that's why traditionally we've always had to get those patients numb, because those pulses are on the order of 3 decimal places longer than the microsecond. Let's go back to this slide here. 150 microseconds is how long it takes the body to feel the response or feel the stimulus, but we're operating at 50 microseconds. So that's why we're able to do these procedures with little or no even topical anesthetic in a lot of cases. And it's not every case, because patient to patient is different, and some you can extract teeth with no anesthetic, and others you need to give anesthetic just to do a prophy. Heck, some of them you seem like you have to give anesthetic just to do an exam. In the same way, most of your patients you're going to be able to use this laser without having to give them local anesthetics. So why do we consider this the best soft tissue solution? Because number one, it's got the 940 wavelength, which no other laser on the market currently has, and this was developed specifically for dentistry. All of the other diode lasers were developed for surgery, for ophthalmology, for dermatology. This is the only one that was developed for dentistry. So that means we can cut tissue that doesn't have to be inflamed or vascular. We get great hemostasis because, remember, the absorption peak for 940 was higher than for 810, so we get better hemostasis. We get efficient cutting, better comfort because of the comfort pulse. They're really short, high-powered pulses, and we have lots of different combinations that we can do to achieve our goals. And why are we reducing chair time? Well, because we're using a single-use disposable tip. This is a very rare thing, because those of you familiar with the traditional diode lasers are familiar that you have a bare fiber that needs to be cut between every patient, and heck, sometimes even during the treatment in order to get a nice new tip. But you will never, no matter how clinically savvy you are, get a perfect, an optically perfect tip by using a cleaving device or a cutting device for that fiber, because it's a glass cutter. So you need to scratch the side of the fiber in order to cut it. By using single-use disposable tips, you're sure that each one is clean. You don't need to disinfect or sterilize these tips. They're individually packaged. They're optically perfect every single time. It's only a matter of, I believe it's 2 rotations on the handpiece in order to remove it, so it's easier than changing a burr. You don't have to take the time to strip and cleave and sterilize your cleaving instruments. You have the opportunity to go from 200 to 400 micron in diameter lengths, which are the most popular. Actually, most lasers operate with a 400. You can use 300 or 200 micron diameters, and lengths from 4 millimeters long for surgical procedures, a little bit longer for periodontal procedures, and up to 14 millimeters long to decontaminate endodontic canals. Very easy to use. When we talk about using an Ezlase, we need to discuss the top 7 surgical or soft tissue procedures. They're not all surgical, pardon me. But these are the procedures that, doing a survey, most practices in the world purchase an Ezlase for. The first, laser curettage, cellular debridement, and I will add bacterial decontamination in here. Here are for obviously periodontal procedures. It's very minimally invasive, because now, rather than removing excess tissue, we're able to fit this 300 or 400 micron tip. And understand that 300 microns is 3/10 of a millimeter. 400 microns is 4/10 of a millimeter. These things are more narrow than a periodontal probe. We're able to get up in here, and depending on which state you're practicing or which country you're practicing, most states in the United States will allow your hygienist to do curettage and bacterial decontamination using a diode laser. We'll talk about the benefits of that specifically in a moment. But it is a lot more minimally invasive. Notice from your periodontal courses that periodontal bacteria are traditionally pigmented, so they will absorb the pigment. The laser energy will be absorbed into these pigmented bacteria more readily. So now we're specifically killing the periodontal bacteria. And this is a procedure that you can do either with traditional surgery or just as a standalone after a prophylaxis appointment, you can do bacterial decontamination and adding in additional income just from that. And again, we'll talk more specifically about that in a moment. Number 2, troughing for your impressions, whether it be crowns, whether it be veneers. What the laser will do will allow us within only a few seconds to go around these preparations, create what we're calling a trough. What this trough will do is obviously allow your impression material to capture the margin precisely. It will also cause hemostasis, so now you don't have that question of what's going to happen when I remove this retraction cord, and it's also going to kill the bacteria. And the fourth thing it will do is give you that low-level laser therapy so that afterwards you're going to have a lot less discomfort after your cavity, after your crown preparation. All those things, how do you quantify that? We're just going to quantify it and say that it's going to save you 5 minutes per crown because you're not going to have to use any astringents, you're not going to have to use anything else, and you're not going to have to put your patient through anesthetic in order to place your cord, and we're going to get time savings and dollar savings because of that. Gingival recontouring, hyperplastic tissue, operculectomies, look at that tissue. And notice that it's so white. It's very fibrous tissue, as you're aware. If you try to use a different wavelength on this, like an 810, you will just burn this tissue. Yes, it will be removed, but it's going to take longer to heal than if you had just used a scalpel. If you have patients in your treatment room all the time that come in like this, even if you're not an orthodontist, if you are an orthodontist, you're going to be able to remove this tissue with just topical anesthetic. If you're a GP, you don't need to inject 15 times around the vestibule in order to remove this tissue. And again, you're going to get hemostasis, and you're also going to get nice, healthy, healed tissue very, very rapidly because you're going to decrease swelling, you're going to increase vascularity, you're going to improve the wound healing in this area. And I mean, how do you put a dollar amount on being able to do that on a child without having to give them an injection? Frenectomies. In my practice in Massachusetts, I do practice in my practice is in San Diego now, but I moved from Massachusetts. We did frenectomies almost on a daily basis. We became almost like a frenectomy specialist, and it was kind of ridiculous because in my professional opinion, I feel that there is no better way to do a frenectomy, whether it be labial or lingual, on a person better than with a laser. We're able to do this with only topical anesthetic. I have never, ever had to give local anesthetic to do this procedure. Honest truth. The healing is so much faster. You don't need to place sutures. Why? Because it's not bleeding, and you place something we call a laser Band-Aid over the area that helps protect it, helps protect the surgical site, keep it infection-free. We're killing bacteria. How many patients do you have that have a frenum that pulls in the labial aspect and causes clefting? We can remove this and treat this using the laser. Number 5, aptofilters for hepatic lesions. Pretty much anywhere you can get, whether it be denture stomatitis or even an irritation from an Invisalign aligner, you're able to use the laser within about 45 seconds to a minute, so we're calling it immediate pain relief. But within 1 minute, we're able to treat the surface of this lesion to the point where this child now can bite on this and it won't hurt. We can treat all of these areas very quickly, very easily, without anesthetic and without pain. And typically what we've seen, and you can corroborate this with laser operators that you know of, it takes about 2 or 3 days for these to completely resolve to the point where you won't even know that they existed in the first place. As I said, you can use the same whitening handpiece to do the pain relief. Well, the whitening handpiece can be used to obviously whiten teeth because of the proprietary gel, and I'll go into that more specifically. And then, again, low-level laser therapy. If you're treating TMJ, if you're treating headaches, if you're treating any surgical site that we do, anything that we do surgically, whether it be extracting a tooth to doing a graft, we treat post-operatively immediately with the laser in order to get this low-level laser effect, and we get better hemostasis and less swelling and less pain and quicker healing, all because of using that laser. So 2 things we're going to discuss a little bit more in depth. Number 1 is the perio aspect, and number 2 is going to be the whitening. It'll take us about another 10 minutes to go through this. So we talk about curettage, debridement, decontamination, and your hygiene. Well, just in general, diode lasers have been used in hygiene for several years for curettage and bacterial decontamination. Lasers in general have been used since the 60s or 70s, but more recently they've been used in a whole lot larger numbers. Now, this is a big statement here. The laser is safe for use on pregnant women, and in fact it's safer than a curette or a scaler. Now, why would that be? Well, we know that we don't want to stir up any of the bacteria when we're doing these treatments on pregnant women. And again, if this particular wavelength is specifically designed to be absorbed into the periodontal bacteria, what better way can we treat these periodontal conditions? And then as far as dental implants, if you have a patient with peri-implantitis, it has been shown in the literature that using a laser, there is no better treatment protocol than using a laser around implants. What are we trying to accomplish? Well, obviously curettage, decontamination, biostimulation, which is another term for low-level laser, and then guided tissue regeneration without a membrane. We can specifically, it's a whole procedure, but we can specifically inhibit the epithelium from regenerating as quickly as the connective tissue. Again, once you get into your training, you'll be taught these techniques specifically, but just think about that. That's the whole race that goes on. We know that the epithelium regenerates about 10 times faster than the connective tissue. Well, what if you could slow down that epithelium from healing as quickly, you wouldn't even need to place a membrane in those surgical sites. This is a modified Widman procedure. It's an older periodontal procedure, but let me just give you an idea of why the periodontal treatment would be in your own mouth. What would you prefer? Normally we're talking about making a cut from the crest of the tissue to the height of the bony contour, and we're removing all of this tissue. But look at what we're removing, not just epithelium, but we're also removing the connective tissue underlying. And that's why when we remove this tissue and we scale and we suture, we end up with these horrible triangles. Well, let's look at this a little more closely. This represents the state of health with the epithelium and the underlying connective tissue attachment. This is representing a state of disease where we've lost both epithelial and connective tissue attachment as well as bone. If we move this image to the left, we see the image or the state of disease. If we use a laser, it has been shown that we can selectively remove the epithelium, leaving the reedy ridges and reedy pegs ready for reattachment. And if we compare this to gross removal of not only recontouring bone, but removing all of the granulation tissue, the epithelium, connective tissue, this is why it takes so much longer for these cases to heal. This is why we have so much loss of tissue volume, loss of papilla. There's just countless things that go wrong with this. In these cases, again, it would take a long time to explain, but you'll be taught in training, we can actually leave the granulation tissue. I know this is heresy right now, but you can leave the granulation tissue in place. The laser energy will actually infuse the granulation tissue and kill the bacteria within it. And non-surgically, we're able to treat patients with mouths like this to this without using a scalpel. Without using a scalpel, we can start with these cases with bleeding and probing and end up with a state of general health. So, can your hygienist use a laser? Well, if the laser is FDA approved, which the Ezlase is, if the procedure is FDA approved, which curettage is most definitely FDA approved, if your state allows your hygienist to use a laser, and if it's within the scope of their education, training, and their comfort. So, in other words, your Dental Practice Act in general will say that a hygienist can do curettage. It won't say that the hygienist can use a hand instrument or a piezo or an ultrasonic or any other thing, and it's not going to change every time a new technology comes on board. So if you can present them with an FDA-approved procedure and technology, which this laser is, that's why in most states hygienists are allowed to use a diode laser. And then very specifically, if we talk about just bacterial decontamination, this is just killing bacteria. This is not doing curettage. This is something you can do on every single one of your prophylaxis patients. If it takes 10 seconds per tooth, 28 teeth per patient, two sides, it's going to take you about 5 or 6 minutes per patient. If we charge, say, an average of about $30 per patient, which is not insurance, which is why some patients say yes and some patients say no, so not only will you get the actual treatment protocol, but you will get the verbal skills and the education to be able to explain to your patient why this is beneficial to them. Some will say yes, some will say no. If 7 patients a day say yes, we end up with a couple $100 in extra hygiene. Woo-hoo. But more importantly, you're going to provide better care for your hygiene patients. It's going to set your practice apart. And again, we want practice differentiation. And then whitening with the Ezlase 940. I'm going to compare this with some of the currently available whitening systems. This is what the handpiece looks like. So it's not a bare fiber that's going to cut. You can place this right on your skin, and it won't burn your skin. It won't. You'll feel a little bit of warmth, but when I say warmth, it's not a burning warmth. Yeah, you can feel a little bit of warmth, but it's not heat. And because of the low level that we're using this in, we're not going to get the type of pulpitis that you may have heard from previous versions of lasers, and it comes with a proprietary gel. How this works is threefold. Number one, you know from even Christensen that if you put the whitening gel on the teeth, it's going to whiten. You know from chemistry class that if you heat it up, normally chemical reactions will speed up a little bit. And then also we have this gel that has a chromophore in it, which is absorbed by this laser energy. Well, as soon as you aim the laser at the whitening gel, it starts to bubble. There's an activity that you'll actually see on the surface of the teeth that will increase the speed of the whitening gel. So again, it has a chromophore to speed the whitening. It's a 38% hydrogen peroxide, which now a lot of the systems are going from carbamide to hydrogen peroxide because of the benefit of how quickly it's working. It does include a desensitizer, so those patients who start with sensitive teeth, it will reduce their sensitivity, and each kit is good for a full mouth. Now, if we compare the Ezlase to all, well, not all, but quite a few of the other systems that are on the market, if you've already using some of these, like a lot of people are using the Zoom, the treatment cycle is 45 minutes, but you know that you need to schedule more than an hour for that patient. If the treatment cycle is only 20 minutes, you don't need to schedule anywhere near an hour for that patient. And the other thing is that you're going to be able to say that you're actually doing laser whitening. Anyone else using a Zoom, a Sapphire, a Bright Smile, do not use lasers. You may or may not have known that and been aware of that because I've paged through lots of Yellow Pages ads and seen laser whitening and then find out that they're using Zoom. So you can actually say that you're using a laser and be honest about it. And because of the shape of that, because of the shape of this handpiece, only the teeth are affected, so you don't have to place sunblock or any sort of protection on the lips and face. If you want to see some specific examples of this, there was a study that was done on the laser smile, one in LA and the other on the East Coast, 22 patients in each of these studies. And as they say on the mutual fund prospectus, individual results may vary, but you can get a tremendous whitening effect using this system. Now, in the laser cases, if you notice in one of the sites, the blue is one site, the purple is another site, over 90% of those cases got over 8 shades whiter, and over 70% of the cases got over 8 shades whiter in the other. And if you compare laser, the number of shades whitened in site 1 was 9, and in site 2 was 9. And when you compare it to a plasma arc, which is the Sapphire, if you compare it to metal halide, which is the Zoom, you end up with less than 8 shades and 7.5 shades whitened. So there is a statistical difference in the amount of whitening that you see from one to the other. And the difference between, not to confuse you, laser white 10 and laser white 20. Laser white 10 is the old way with the older laser to do whitening. Laser white 20 is the new proprietary gel that's used with the Ezlase. So rather than 15, 16 minutes of contact time, we're talking about 5 minutes. Exposure time is 1 minute, and the shade improvement is 13. This was from lab tests. So it's 44% more effective, the new laser versus the old laser in whitening, and it only takes a third of the time compared to the traditional method. A third of the time means that you're going to have less heating. Less heating is going to be less pulpitis, less sensitivity afterwards. You're going to get a nice result. And I'm not sure I would recommend. I'll tell you my own personal experience is that I didn't buy the laser to do whitening. We already did whitening. I bought the laser to do all the perio and endo decontamination, which we really haven't even touched on, and the surgical procedures like frenectomies and doing our cosmetic gingivectomies and things. The whitening just came as an adjunct. And just think about it. If you do one whitening case with this laser per month, that's going to take care of your monthly payment on this laser. That's how silly this whole thing is. So another reason for using the laser versus bleaching trays, these are SEMs of surface enamel before and after bleaching tray. Before and after bleaching tray. Look at the porosity in the surface of this enamel after using a take-home kit. When we compare that to using a laser, this is before, this is after. Before and after. There's really no discernible effect. There's not a discernible porosity on the surface of these teeth. And part of it is due because of the actual laser, and part of it is due because of such a short treatment time of 20 minutes. And studies show us a long exposure time increases the risk of damage to the dental hard tissue. That's true in everything that we do. The quicker we can do it, the more minimally invasive we can do it, the faster the patients are going to heal, and the less sensitivity and the less post-op pain they're going to have. So in conclusion, it is a portable laser, but it's portable with power. There is no other portable laser that has 7 watts of power. And, people will tell you, well, geez, you're never going to need 7 watts of power to cut tissue. That is true. You're probably going to cut tissue at about a watt or a watt and a half, 1 or 1.5. So what does the 7 watts help us do? We have all sorts of control over the length of the pulses, the length of the thermal relaxation time, the number of pulses that we apply to the tissue, and that's how we can make it comfortable. The wavelength is 940. There is no other 940 wavelength. I'm sure there will be soon, but there's no other 940 on the market at this point. 50 microsecond pulse. It's under the 150 microsecond threshold in order for the patients to actually feel us using this laser. They tell me that it feels like I'm using a perio probe. That's what it feels like. It's only 2 pounds. It's small. It's portable. It's convenient because of its battery pack. The battery pack, because of it, you don't have all these cords coming out of it. You have single-use tips, which are very simple to use. They're bendable. And why is bendable important? Because now instead of having to use it at 180 degrees, you can bend it at 30 or 40 degrees in order to use it like a normal handpiece. And we have a wireless foot pedal option. I hope I haven't hit the topics that you wanted. My mobile phone number is here, 858-208-9100, and you can reach me by email at walensky@ymail.com, and I welcome any questions at this point. So I see that there's a question about the Picasso laser at 7 watts and how is the Ezlase better. We have Dr. Wayne Harrison on the line, I believe, who will probably be able to address this.
You're actually better at it than I, Dr. Walensky, because I'm not real familiar with that laser, and you've had more experience in bleaching than I.
Well, as of this time, I know that the Picasso does not offer a whitening handpiece, and you're going to end up losing the ability to whiten teeth, and you'll also lose the low-level laser effect because you're not going to get it as precisely and as conveniently and efficiently using a bare fiber, and actually probably be a little bit dangerous to use a bare fiber to do low-level laser therapy. As far as cutting, I'm not familiar with. I believe it only comes with a 400 micron fiber. Again, you can't quote me on this, but I believe it only offers the 400 micron fiber versus a 300 and a 200, and it would be very difficult to get the 400 fiber down as far into an endo canal. If they do offer a 200, then call it X. But at this point, I believe that they only offer one size fiber to that, and I don't believe. Again, I'm just guessing. I don't think that they have disposable tips. I think
they do not. No, okay. They do not. In fact, when you look at the benefits of the Ezlase, as you so eloquently pointed out, I think having different sizes of tips, not only different diameters, 200, 300, 400. Just picture for a moment if you were doing a gingival recontouring on very thin or friable tissue, you could switch to a smaller tip and turn your energy down and certainly have a much better effect than anything you could do with an electrosurge. One of the things that we find, Dr. Walensky, and I'm sure you would agree, is that most people that are moving to a diode have been with an electrosurge in the past, and of course they're used to that kind of continuous wave, cutting, which we can certainly do. But I think one of the interesting things to do is to turn our laser up to 7 watts of power and cut into a tomato. And it's interesting, you can literally watch the tissue inside the tomato start to boil and effervesce out. And if you think about that, if that's on a tomato, imagine what that's also doing, to the tissue. So the bendability of the tips is also very, very critical. And one of the things we didn't cover in the webinar is that we actually have different lengths of tips. So when we're doing the hygiene procedures that Dr. Walensky shared with you tonight, we actually have a tip that's 9 millimeters that sticks out of our bendable cannula, which makes it almost like a periodontal probe for the hygienist when they're able to use the laser.
Terrific. Thank you, Dr. Harrison.
Are there any other questions for Dr. Walensky?
Okay, then.
Well, I want to thank you, Dr. Walensky, certainly for a wonderful presentation. I want to thank all of you who attended. You saw in the chat to all the panelists that any of you at any time can go to www.biolase.net. Not only will Dr. Walensky's webinar be available within the next 2 days for private viewing, but there are 7 or 8 other webinars that we've completed in the last 2.5 or 3 months on topics such as endodontics, periodontics, orthodontics, oral maxillofacial surgery with dental implants, and a variety of other topics that might be of interest to you. These webinars are free. You can log on at your leisure any time of the day. All that we do is ask you to register so that we have some idea who you are. The other thing I would like to share with you is please check back to the Biolase website. We have launched a complete series of webinars between now and the end of the year. We'll be publishing this series within the next 7 to 10 days, and you can certainly come back and join us if you have any ideas at all of webinars that you would like to see, or if you're a laser owner and you would like to have more events like this to help you in your learning and treatment of patients. Please send me an email to wharrison@biolase.net and or cross@biolase.net, and we'll make sure that we take your suggestions into consideration for any other webinars that we may be having in the future. With that, on behalf of Dr. Chris
Wayne, I'm sorry. Sorry to interrupt you, but we have received some other questions.
Good.
If we have a few more minutes, take a look. I've forwarded them to you.
All right,
now.
Here is a question, Dr. Walensky, from Dr. Seto. If we have a patient whose periopocket depth is about 7 millimeters when he first presented to me, what should I do in the first visit, and what would be the treatment schedule, dosage review, and retreatment regimen to the patient?
Thank you. So the periopocket depth, if it's 7 millimeters, it would make sense, or I must say, it would affect treatment whether that 7 millimeter pocket was on a single tooth or a full mouth. In that, it's a whole lot more predictable and easier to do, obviously, to treat a single tooth, and the regimen would be different for a single tooth than it would be for a full mouth. As far as what treatment protocol, typically what we'll do in that case, because it's 7 millimeters, because we're doing curettage, this is a case where local anesthetic is necessary. And usually I'd be more comfortable if my patient was completely numb. In those cases, what we'll end up doing is, first pass is I'll do a curettage procedure with the laser. What this allows me to do and affords me is when I put the initiated tip, so I'm assuming this, Dr. Seto understands this, but putting an initiated tip into the pocket in order to remove the granulation tissue, remove any bacteria, and actually create a little, almost a trough around the tooth. This causes hemostasis, so this will actually allow me to visualize and look down into the length of the root, be able to see calculus to help better efficiently remove it. The other thing that it will do is sort of open up the pocket and allow us to sort of reflect it back a little bit, so it's not like reflecting a flap, but it definitely eases the tension on the pocket tissue so that we're able to get our hand instruments down there. So the first step would be to use an initiated tip, removing, kind of doing a curettage and removing that layer of epithelium that's been affected or infected. Go down in with hand instruments, ultrasonics, whatever you need to remove the calculus and do root preparation. And then because we've dislodged calculus, we've dislodged bacteria, I would go back down in there at a different setting, and in this case with an uninitiated tip. So now we're going to have laser energy be able to infuse the tissue, kill bacteria, so we're going to be able to decontaminate that pocket. So understand that the first step actually removed the infected epithelium. Second step, mechanically removed the calculus and prepared the root surface. And then the third step, after irrigation, is to kill the bacteria but not remove any more tissue in those cases. And then we place our medicaments. And as far as treatment schedule, we typically will let those patients heal for at least a couple of months before we reprobe. Usually we get them back, we get them back in a week to check, but we don't reprobe them until we allow the tissue enough time to reattach. Something like a 7-millimeter pocket is kind of, it's right on the borderline. Most of the 7 millimeters will resolve back to about 4 millimeters, 3 or 4 millimeters. Typically you get about half back. But if it's 7 millimeters on some patients, it may take a second round of treatment. Usually from 7 to 9 millimeters, kind of right in that range, is where I'll tell patients if they have 8 or 9 millimeter pockets, I will typically tell them that we'll have to retreat them at some point in the future. So 7 millimeters is right on the border. If I'm at 6, I'm pretty comfortable that I'm going to be able to do this in one round. But again, that's why I kind of hesitated at the beginning, because it's right on the cusp of whether it's going to need one treatment or a second treatment down the road. And typically we won't do the second treatment until maybe 9 months or 12 months after the first treatment. It's usually about a year after the first treatment when we'll do the second, because understand we won't leave it at 7. We'll probably get it down to maybe, in the cases that fail, maybe 5 millimeters, and then we can kind of keep an eye on that and then get that 5 millimeter down to a 2 or 3.
One of the things, Dr. Walensky, I would mention that they can send an email either to yourself at walensky@ymail.com and or to wharrison@biolase.net. And we would be happy to provide, some suggested settings for them. I think it's important to remember, though, that every patient is different, every pigment is different, every application is different, so it's not necessarily always one size fits all. I have another question here for you, Dr. Walensky. It says, I've done a vestibulectomy to increase the buccal sulcus for a complete denture. The lip was swollen terribly. Could this be due to the power setting being too high? How can I cut faster without getting the same swelling result?
Well, it's probably due to too much power or too much laser energy. Either the procedure took you too long, or in general there was just too much power. Understand that because of the ability to pulse the laser, you can have the laser at, say, 4 watts continuous, or that's a bad example, at 2 watts continuous, or you can have it at 2 watts pulse and end up with completely different results. If you have the laser continuous, because of the increase in heat, yes, it will cut faster. You'll love the way it cuts, especially if you're used to using an electrosurge, but the thermal damage that's associated with that is not worth taking that risk. You can cut at 2 watts where it's pulsed only a quarter of the time or half of the time. In other words, the laser is actually off for half or 3/4 of the time that you're using the laser. Imagine that. It's only on for 25% of the time or 10% of the time that it's on, and off for 75% of the time. and you're going to end up with the same 2 watts of power, but you're going to end up allowing the tissue to cool in between pulses, like that chart that I showed earlier. And so it's more a matter of playing. I would just maybe, like Dr. Harrison said, grab some, as silly as it sounds, grab some tomatoes. The tomato works very, very well to duplicate a very, very thin friable tissue, something down around 24, 25. You have very thin, healthy tissue. That works really well. Carrots work really well for fibrous tissue. And even, if you can get your hands on a model like a pig jaw or something like that, that would probably be the ultimate. However, remember that the pig jaw is going to be cold. It's usually refrigerated because of obvious reasons. In order for the laser to cut, it needs to heat the tissue up to 100 degrees Celsius, the boiling point. Now imagine if you're working on a human, we're a whole lot closer to 100 degrees than a frozen or a thawing pig jaw. So it's going to take a lot longer to cut the pig jaw tissue than it will to cut the human tissue. And just as Dr. Harrison said before, he kind of said it quickly. I don't know if you got it, but pigment is even different. So if you request from me or from him, please send me the settings on how to do a gingivectomy. We'll give you some guidelines, but if the tissue is very red and bleeding, you're going to need far less power in order to cut that tissue because the pigment is going to act as a heat sink, and the tissue is going to end up getting heated up, and you're going to end up with some more thermal damage. Whereas if you have very healthy pink tissue and you're doing a veneer case and you're just trying to even up the levels of the 2 centrals or something, you're going to need you're going to need a little more power in order to cut that tissue and end up getting the same result. I think I got way off the topic, but I apologize.
No, actually, that was very, very good, Dr. Walensky. I certainly appreciate that. I just want to remind everyone again to please check back at the www.biolase.com website for our future 2009 webinar schedule. If any of you have interest in any of our Biolase products and would like to have a conversation with one of our Biolase laser specialists to discuss how any of these products could enhance your practice, as Dr. Walensky said, it's a matter of efficiency of time. It's an opportunity to add new patients to your practice because of the laser, or even doing additional procedures that you may be ignoring or referring out. You can contact us at Biolase 888-424-6527. Once again, 888-424-6527, or email info@biolase.com, or you can always contact our exclusive distribution partner, Henry Schein. So again, on behalf of Biolase Technology, Henry Schein Dental, Dr. Chris Walensky, Carl Ross, and myself, we wish you a good night, and we look forward to seeing you again in the future.
good. Yeah, that's good. That's good. Yeah, that is good. I thought this was a different type of presentation than the ones we've had recently, but I think still good, and it's going to have its value as